You can learn a lot from academic papers or information from other international organizations, but while in Africa, we wanted to hear from implementers about the challenges they're facing on the ground and maybe what some of the solutions could be. This is just a piece of what we found.
There's this sign of malaria, which we are talking of convulsions, especially for under 5s. The convulsions under 5s is a serious one because you find these under 5s, once they start convulsing, the member of the family, be a mother or a father or auntie, they are associating it with witchcraft, and that these convulsions, they could be best treated with a herbalist. So they don't really take prompt measures to take this child to the health facility. Instead, they start now going through this chain of places, which now makes this malaria, even if it was unsevere, to move into severe mode of infection. The available human resources for health, you find that change of the policy in terms of like prescribing this anti-malarial also have been overtaken by the knowledge which these health sector cadres they have, because you find they were trained on how to prescribe chloroquine or how to prescribe fancied metacalfin. Now we are talking of ACT, which is a bit complicated, and it needs really skills to be able to really prescribe it properly and effectively.
Looking at some of the challenges, it's really on the knowledge, understanding about the malaria. What can be done about malaria, the prevention, not just the cure. So some of the interventions we have been distributing nets, and we see that yes, the nets are there, but the use of the nets, sometimes they are not used as expected of people, because we are telling them that it's a net. The understanding the importance of using the net as a prevention, we need to do a lot more in educating people to understand how the nets work.
Talking of like these nets, the polyester nets, whereby they have attached a feel of a nylon, more or less similar to those fishing nets, which again also they are being used for economic purposes for the families who are mostly those who are maybe residing near the water sources, like say near the ocean or near the lakes. They're using them for that purposes.
In public health, we said that we needed to communicate for change behavior. Because some of the causes of not using, it's a culture or things which people think will happen. And to change that, you cannot change it by just giving them information. You really needed to work with them so that you communicate in such a way people will internalize and see that they needed to change their behavior. So if they thought they were doing the net because they are told it's that, they needed to see that they should themselves look for the net because they understand the importance of the net. So this kind of new approach in educating people for change of behavior is what we needed to do. And it will go in a long way also in the prevention.
At Malaria No More, we're dedicated to learning from these challenges and others so that we might help change behavior and see an end to malaria deaths. Malaria Watch TV is a production of the Malaria Policy Center in Washington, D.C., a project of Malaria No More. For more information, visit our website at malariapolicycenter.org. Pretend it's not even there, right?